Welcome and welcome to the HCCI webinar, The Return of the House Call, 10 things you and your loved one should know about home-based care. We've got a very exciting and full agenda today for you and really appreciate your joining us. So why don't we go ahead and get started? Our presenters today will be Julie Sachs. She is the president and Chief Operating Officer of HCCI. Her main roles are to develop and execute our strategic plan, establish relationships with our donors and foundations, and serve as our spokesperson. Today's a good example of that. And Dr. Paul Chang. Dr. Chang is a senior medical and practice advisor for HCCI. He's also the medical director of Northwestern Medicine Home Care Physicians. He helps us by developing curriculum, educating and training our providers, doing ride-alongs, etc. He also offers consultation and guidance to growing house call programs, and he presents nationally on the value of home-based primary care. So what is HCCI? I can hear you saying out there. So HCCI, we're a national nonprofit. We're based in Illinois, and our main mission is to advance home-based primary care to ensure that medically complex patients have access to high quality care in their homes, which is where most people would want their care if they could. And we do that through three main pillars: education, consulting, research, and advocacy. So for advocacy, we're talking about awareness. And then this webinar today is a good example of spreading awareness of house calls and HCCI. Today's objectives, first of all, as we just said, to increase awareness, right? And we're going to be talking today about the house call. You may know it by different terms. You may hear home-based primary care. We call it the modern day house call, and we'll get more into that later on why we call it that. And what we're all doing to scale it, right? That's the key, and you'll hear more about that as we move forward. And the second objective is to prepare you for the future of healthcare. And what does that mean? That means that, especially with the recent pandemic, we've all seen how important house calls are for patients, caregivers, family, for the health system, for the world, really. So we'll talk more about that so that you won't be surprised. You'll be ready for the future starting today. And then we're going to share how you can help, right? And there are many ways you can help. You can help us, but most importantly, by helping us, you're going to help those providers and practices like Dr. Chang actually go out and help those patients who most need it. You'll hear more about that later. So at this point, I'm going to hand it over to Julie to begin to take us through the 10 lessons.
So for those of you who remember David Letterman's top 10, I don't know if this will be as comical, but I'll try to be as entertaining as I can be. James, if you want to go to the next slide. So most people, I think, by this point have heard about the video, Simon Sinek's video, Start with the Why. And so that's what we're going to start with here. Why is this important? I think the statistic that we have about 10,000 baby boomers turning 65 every day is a pretty well-known statistic by this point. What you might not know is that the people that are over 80 is rising incredibly fast as well. And those older adults often have difficulty with their activities of just daily living, bathing and dressing and making meals for themselves, etc. And that's often a group that has, some difficulty getting into a doctor's office, whether it's because of dementia and it's very disorienting, or whether it's because of some kind of physical disability or just plain frailty. And so while there are different kinds of house calls, some of you may be familiar with the term concierge medicine. Concierge medicine is generally something that individuals who can afford to pay for it will hire a physician or a nurse practitioner to sort of be on call for them. That's not the kind of house calls that HCCI is necessarily advocating for, because that can be afforded by a certain group of patients. What we're trying to do is help primarily people that are on Medicare or Medicaid or both, and don't have the means to be able to pay for that kind of personalized care, but who still should have access to it and really deserve it as they age. And so we're trying to address that older group of people. We all know and have heard for years that there's a Medicare and Medicaid crisis. And with that many people aging that rapidly, it's just going to put even more stress on the Medicare system. One of the other things that makes this an important why is that there are better health outcomes. Oftentimes, this group that's homebound or home limited and has difficulty getting out and about will resort to using the emergency room as their primary care physician. When they have an urgent situation, they call 911, they get transported to the emergency room. That physician does not know them. They don't know all the medications or all the specialists that may have prescribed medications to them. And so it's really just this snapshot in time. Whereas if they have a house call practitioner, that person goes out and sees them regularly, knows their case, knows their family, and as a result, there tend to be better health outcomes. And it's not only that it is better outcomes, it saves money. It saves money for everyone involved. It saves money for Medicare, because oftentimes you can prevent an emergency room visit or a hospitalization. It saves money for, and then, it would save money for the patient as well. And some really good news about this is that our system is changing. And that's another thing that HCCI advocates for. We help, we work with other organizations in this space to advocate on Capitol Hill, to advocate for regulatory and legislative change, so that the healthcare payment system is more welcoming of this kind of care. And that's starting to happen more and more frequently. The Centers for Medicare and Medicaid Services is recognizing, and I think is beginning to agree with HCCI. We've been saying that the future of healthcare is in the home for quite some time. And I think that they're starting to realize that and support that with policy. So that's a little bit about the why. Let's go now to the what. So what is home-based primary care? We say house calls, but there's lots of different kinds of house calls. Like I mentioned, there's concierge care. There may be home health. So oftentimes, in fact, some of you may have had home health. You're discharged from the hospital, and you have a sometimes you might have a wound care specialist come to check on you a few times a week. You might have a home health worker come and help you bathe and dress, and oftentimes there's even companion care. So that's all wonderful, and sometimes the home-based primary care doctor or nurse practitioner will work with those people, or even sometimes prescribe home health. But what we are really focusing on here today is home-based primary care. And what that means is a primary care provider, just like you would go see at an office, but they come to you. And the reason that HCCI exists is that with that aging society I mentioned and how rapidly it's aging, the demand is much higher than the supply for this kind of care. And the gap is widening so quickly that our founder, Dr. Tom Cornwell, and some of the philanthropists who helped to start HCCI decided that this was so important that it had to be addressed now. And so we focus on trying to shrink that gap, and we want to meet the need. Right now, there are 5.9 million people in the US who need house calls, and only about 85% of those receive it. I'm sorry, I said it backwards. Only 15% of those who need it receive it. There's an 85% gap. And so if you think about that, you know, think about another kind of care, like oncology care. What if only 15% of our population could access chemotherapy or could access cancer treatments? That would really be shocking and frankly unacceptable. And we believe that this is no different. People that need this kind of care should be able to access it. And so HCCI works to create a workforce that can help fill this gap. We need more practices and more providers doing this kind of work. So what if that doesn't happen? What if house calls don't increase? Well, there's not going to be enough primary care. There's not going to be as many people that can age in place, age at home, which is most people's preferred place. The complex conditions, the kind of seriously ill people that home-based primary care practitioners usually take care of, their conditions just worsen when they're not cared for. And that the pandemic was a great example of that. We saw lots of people postpone their primary care and their conditions worsened. And what happens then is you have more people going to the emergency room, being admitted to the hospital. So what happens on the flip side if we are able to increase house calls? You see the flip side of that happen here. There's more primary care, which enables more people to stay at home and be among their family. The complex conditions get more controlled. There's less emergency room visits. There's less hospitalizations. And again, that goes back to tying into the cost and the quality of care. The quality of care goes up, the cost of care goes down. I think now I'm going to turn it over to Dr. Chang to talk to you for a few minutes.
Julie, thank you. And thank you, everybody, everyone, for spending a little bit of time with us this afternoon. So obviously our patients and our caregivers, they have conversation with us as clinicians and as team members of a house call practice. But do houses or do the walls talk? And I'm going to argue that yes, they do. One of the beauty of a house call is that the visit of a house call starts when you pull up to the curb, when you pull into the parking lot, when you look at the neighborhood, the surroundings, and you look at the house. They begin to speak to you what you may be facing as you enter the home. Both it could be a good thing or it could be something that's perhaps more challenging. And one of the things I love to do is what I call the walkthrough. When I enter the home, I take a moment to really let it all soak in, from what I see, from what I can smell, from what I can hear. They all give me some information, some clues into the patient's past, into their history. And why is that important? I think it is so important for me to get as much information as I can to build that bridge, to build that relationship with our patients, because our patients are more than just a collection of diseases and illnesses. They are people, and they have a story to tell. We just had Memorial Day. Walk in, there's an American flag, or there could be war medals and so on. They all serve as a bridge to that conversation, that relationship, which is so important in a house call visit, because our conversation can turn pretty intense quickly. We're going to talk about end of life issues or crisis that may happen in a relatively short period of time, because as Julie said, these patients are older and they are sick. And having that trust, having that relationship with a patient is so important. It allows us to take care of the whole person, right? There's a lot of talk now in medicine about social determinants of health, and we get really a experience of what challenges they face when we make a house call. The places I love to visit in a home, obviously, is where they rest or sleep, but also the kitchen. Check the fridge. We call that the refrigerator biopsy, right? Are they getting the adequate nutrition? Are they living in a food desert, even though they're in a wealthy DuPage County that I'm practicing in? The other would be like the bathroom and so forth. Are they having difficulty getting on and off the toilet, in and out of the shower, for example? So being at the home, the experience and the knowledge really starts, and the walls really do speak. Next slide, please. So not only do we have high touch care at home, with the rising technology that's changing every day. Now you got the Apple Pro Vision virtual reality device that was just announced. We have technology now at home to help us deliver high-tech care at home as well. You can see from some of the diagrams there, we have X-ray capability, we have ultrasound capability, we have point of care EKG capability. And that device at one of our sessions, we were teaching on a handheld ultrasound machine called a point of care ultrasound, or POCUS, really gives us the ability to better diagnose, better treat, better care for these patients. Now, remember, Julie talked about these patients are sick and complex. And if we can deliver the care that they need and they want to be at home, avoiding the hospitalization and the high cost centers, the technology is helping us to deliver on that promise of great care at home as well. Next slide, please. So what does a house call look and feel like? I already gave you some clues into stepping into the home and observing everything, the sight, the smell, and so on. Some people think that a house call is just an office visit in the house. If that was true, then HCCI we don't really need to do any kind of education or teaching and webinar or so forth. But that's just not the case. There's much more to a house call than an office, superimposed at home. When we teach house call medicine here from HCCI, yes, we do base our curriculum on the 4 M's of geriatrics care. The 4 M's are what matters most: mentation, mobility, and medications. The 4 M's, then we superimpose that on the competencies that are necessary to be a good house call clinicians. Some of those competencies are being competent with complexity. That's pretty self-explanatory. being able to communicate comprehensively, and having character and charisma when the going gets tough, when the visit is challenging, whether it's from a complexity standpoint or from a hoarder's house that you might be entering into, having that composure. And the last is having that charm, that winsomeness that's necessary for you and your patients and your caregivers, that they're looking to you to guide you through difficult times, having that charm and then the charisma, that leadership to lead your patients and their caregivers through difficult waters, and also to lead your practice as we go through, as Julie talked about, changes in the marketplace, changes in reimbursement, and so forth. So we teach all of that from HCCI. So when you have a competent and caring clinician stepping into the home and delivering care at home, you are going to likely get some of these comments. And I'm going to share some reflections. These are actual quotes from patients. First is from the patient's perspective. It says here that knowing that there is a provider who cares and can come to the house make me feel at ease. Those are powerful words. What about from a caregiver's perspective? Remember, we treat the patient and the caregiver because they often depend on each other, because our patients are often weak or debilitated. And the caregiver says, it is reassuring to me as a caregiver to have a house call provider, because there are times I don't know what's going on with the patient or what to do. Having someone to talk to and get guidance and reassurance is such a blessing. And finally, from the provider's perspective, we hear so much about burnout and stress and so forth. The provider writes, it is a very personal experience to be in the patient's home, and being in the home gives me a better understanding of patient struggles and allows me to have a deeper relationship with my patient. And that's why we went into many of us went into medicine to begin with, is to take care of our patients and have that close relationship with the ones that we are caring for. And this, I'll finish this section here with the patient's a response to our practice. It says here that since day one, the provider and the team have taken care of all of our needs, answered all of our questions, and given us hope in an unbearable situation. We are that hope. We are that contact point. We are that access for our patients when they're really struggling with their illnesses or with their loved ones in terms of what to do. Julie, I will turn it back to you.
Thank you so much. So I think everyone can tell by listening to Dr. Chang that he has that charm and charisma and compassion. And one of the things that we do at HCCI when we have a new staff person start, we ask them to go out on a day of house calls. And it is really amazing to watch a house call physician in action or a nurse practitioner in action. And Paul's exactly right. We hear from the people that we train so often that that it's just a different kind of relationship that you're able to build with the family and your patient. And it's so meaningful, such meaningful work. And so it's really gratifying to work with that kind of a professional population on a daily basis. So if we continue with our top 10, you may be asking yourself, well, who pays for this? And the answer is, it generally works the same way an office visit would work. Like we talked about, the patient population is generally an older one for a home-based care provider. Now, there are some that see pediatric patients. There are some practices where even Dr. Chang's practice, I know they see some younger people that have had falls, that have trachs, that are being cared for at home from some kind of progressive condition. But for the most part, it's people that are on either Medicare or Medicare Advantage or Medicaid or some combination. We're seeing more and more regular commercial insurance paying for this as well. The reason is that cost piece, when I talked about that earlier, it saves money. You may not know that Medicare beneficiaries account, the top 5% sickest Medicare beneficiaries account for 50% of the cost of Medicare. And the top 1% account for 23% of the costs. So I'm gonna let that sink in for a minute, because those numbers are just shocking. So if you can take care of that sickest group at the top of that pyramid, think about how much money Medicare can save and what could be done with those savings. And so that's why we're starting to see the kind of policy change I was talking about. And it all bodes really well for the return of the house call. Let's go to the next slide. So I talked earlier about the need and HCCI's efforts to build a workforce. Right now, today, there are about 3,000 providers that are doing house calls in a significant way, meaning full-time or close to full-time. And see all the dots, you see that they're more on the coast. It's even more challenging to do it in rural settings. So for the most part, we see more house calls happening in larger cities. But there are 12,000 needed. So that's the gap that I was talking about. And the gap is just going to widen. And so HCCI works to educate not only current providers or encourage current providers that are doing another kind of care to consider house calls. We also are working to train future providers. So many times residents and nursing students aren't exposed to house calls at all. And there are a handful of programs that expose them to house calls during their, let's say, a geriatrics rotation. Dr. Chang takes students out all the time. And I can't tell you how many times we've heard from a student that says that going out, I told you, going out on a day of house calls is incredibly, it makes a huge impression. And oftentimes that's all it takes for somebody to choose this as a career. So HCCI works to increase awareness of the need for this kind of care and the value of it, like we're doing with you today. We do education and training for the field. One of the reasons that there tend not to be enough providers is that it's not really perceived as a prestigious field. Like Dr. Chang said, it's not a medical specialty. We think it should be, and maybe it will be at one time in the future. This is a group that's taking care of such complex patients. It takes such skill and commitment to do it well, that it really, in my mind, is prestigious. It just doesn't have that reputation yet. And so we're working to change that. And it also, frankly, it doesn't pay what a surgeon might make or a radiologist might make. But the passion and the meaning that you hear in Dr. Chang's voice and in the people that we train, it's incredibly gratifying. So if you go to the next slide. So how do you find a provider? Number one is, I would say, ask your current provider. Do they do house calls, or do they know somebody in the area that does? If you have a loved one at home who is starting to struggle to get out of the house, and it takes half the day to get them to the doctor's office, ask your doctor. And asking has multiple purposes. There aren't enough providers. It's not unlikely that your physician would say no, they don't provide house calls, but you should ask anyway, because we're getting to a point where we need to demand this kind of care from our legislators, from our health systems. When HCCI started about 8 years ago, we made the decision to start educating providers first. We wanted to train more people to do this so that when you started to ask for it, you could find somebody to come into your home. We're still doing that education, but it's at the point where we feel like the public needs to start asking for it as well, that we need to work from a sort of top-down and bottom-up strategy. So number one, I would say ask for it. Number two, become an HCC insider. So this is a brand new program. In fact, it hasn't launched yet. It launches next week. And what that means is kind of come into our inner circle. We are kicking off a program where if you donate to us and help support our work, you will become an HCC insider. And if you donate at certain levels, you are able to request up to a couple times a year, a list of providers in your area, in your town, in your zip code. So, or if you have a loved one living somewhere in another part of the country, you can request a list of providers. We have a brand new product, a data analytics product that we can source that information from and provide that to you. And then finally, we work very closely with the American Academy of Home Care Medicine, which is a long name, AAHCM for short. And they are in the process of creating and even improving the first provider directory. And you can find that on their website, but you can link to it from our website, hccinstitute.org. And so that's another place to find a provider. And so that was our top 10, but I had one more, so we made a bonus. This is really number 11. But how else can you help? James alluded to this in the beginning. How could you help? You could become one of our new HCC insiders and support us with a donation or a gift. But you can also sign up for our newsletter on our website, follow us on social media. You can refer your provider to us. So let's say that you go to your doctor and say, does this hospital system offer house calls? And they say, no, but tell me about that. Tell them to contact HCCI, to tell them to look into our website and what we're doing. I mentioned policy, write your congressperson. If you have not ever written your congressperson, know that a personal story is really important in those letters. And so if you've had a situation in the past, let's say, where you've had somebody who could have used this kind of care, write your congressperson, say that you came to this webinar and you wish you had had this kind of care for your family when you needed it. Those things make a difference. And then finally, if you do nothing else, tell somebody that you came to this today and something that you learned, and share that there's a resurgence of house calls and there's an organization out there advocating for it. And and then you become kind of one of our ambassadors and you help us to spread awareness and to be an advocate for this kind of care. So I'm going to thank you all in advance for helping us to do that.
Thanks, Julie. Appreciate that. And, before we move forward, when the tell someone piece is really important. When I joined HCCI about 4 years ago, I oversee marketing, communications, and PR. So I would talk to reporters, and reporters, their first question to me would be, are house calls really a thing? And that told me a lot, right? That we needed to raise awareness. And I would talk about house calls, but then I went out on house calls and I shadowed house calls with Dr. Cornwell and then with Dr. Chang. And once you've gone, and literally you only need to see one or two, and it's transformative. I mean, it's so powerful to see. And I don't get many questions like that anymore from reporters. So that's a good thing. However, one-on-one is really important. And this isn't just to share with people, what HCCI does, how important it is to support us in our work in helping providers and practices. This is important because people need this. So the story I always share is, I was out taking care of my lawn one day. I looked over and my neighbor was looking distraught in her driveway. And I walked over and she said her husband had been in the hospital for a few weeks, was at home, and they didn't know what to do. They couldn't get him to the doctor, and he needed care and he had no idea. And all I said was, have you ever heard of house calls? And, she'd had them as a child, but she didn't think they even existed. So I just shared a little bit about house calls. I told her, to talk to their system and their primary care provider. And if that didn't help or didn't get them what they needed, to let me know and we would help. And just to see the look on her face was very powerful. She realized, it looked like she realized she wasn't alone anymore, and her husband wasn't alone, and that there was some hope for her. So really, house calls are hope. I mean, when it comes right down to it, that's where we all probably want to be. So I wanted to thank Julie and Dr. Chang for everything today. We wanted to open it up for questions. I don't see questions right now. I have several questions I was going to ask them for you, but I would prefer to, if we have any. Irene, do you have any on your end?
Nope, I don't see any in the Q&A box and nothing in the chat box either.
Okay, so we're going to, through the miracle of technology, we're going to transform this into a quasi panel. So Julie and Dr. Chang, I had a few questions for you, and to the audience, if you have questions, please ask them and we'll get them answered for you. The first question is, we talked a lot about the patients, and I know Dr. Chang, you talked about the caregiver, but we heard about those 85% of these patients who can't get this type of care. For those patients, I'm assuming that the people at home are taking care of them, and that's a lot of pressure, et cetera. So what do you both think about, what does this mean for caregivers? What do house calls mean for them?
I can start, James. As I stated earlier, when we go and take care of these patients, because of their complexity and their illness, we need to take care of not only the patient, but also the caregiver. The dyad illustration I used before, it will just be an ongoing thing, I believe, just given the nature of our patients. So of course we take care of patients and their needs and so forth, but tried to get into a habit of, especially for new patient visits, of closing the laptop and just directing my attention to the caregiver for a few minutes and just asking them, addressing any questions or concerns from them, and ask them how they are doing. And often that's when the tears starts to flow and the lip starts to quiver. Uh, and the common answer I get from these caregivers, the answer is something like, nobody's ever taken the time to ask me how I was doing or what questions I have. And yet we depend so much on them to deliver the care that our patients need. So my point and being here, and I'll turn it to Julie, is that don't forget the caregiver. The caregivers, when we make these house calls, take care of the patients, take care of the caregivers, make sure their concerns, their questions are addressed, because if they feel unsupported, if they don't have confidence in your abilities and skills and so on, when there is a crisis with the patient, what are they going to do? They're going to call the ambulance and take them to the emergency room. And as Julie said, the ER really is not set up for ongoing continuity of care for this group of patients. So Julie, any comments from you?
Yeah, I mean, I can just speak from my own experience. My mom had early onset dementia, and so by the time she was about 60 or so, she was in a nursing home. She was in assisted living first and then a nursing home, and lived out her life in a nursing home, which most people don't want, and most children hate to see their parents in that situation. And I think what I wish is that I'd had a relationship with a provider like Dr. Chang has with his families. There's something about going into the person's home where I think you'd agree, Dr. Chang, that you become part of the family. And when my mom had a problem or I needed a question answered, I was either calling the social worker who was too busy to answer my question, or I was talking to a nurse and it was a different nurse than the last time I talked to somebody, and they didn't know me because I didn't go in often because I lived in a different state. And so it's kind of that same lack of continuity of care that we talk about at the emergency room. If the place where your loved one is living doesn't really know you, then it's really hard. And like you talked about, Dr. Chang, now with all the technology, if it were today, and my mom had in-home care, I could join just like we're doing on Zoom, right? I could join the visit, I could talk to you and share my concerns. And so it really does, like James said, transform healthcare. And we use that term a lot internally. And that's what we're trying to do. We're trying to transform the healthcare system to prioritize this and to help people age in the way and in the place that they would like.
Just Julie, just a quick story. I have many stories. I've been doing this for a long time. One of the stories about being part of the family, right? I had a resident shadow with me recently, and we made a house call with a patient, and it was his birthday. And there was a small family gathering, and we made the visit, and then we put on party hats that was made by the grandson. And then we had ice cream, birthday cake at the end of the visit to celebrate. And I said to the resident, I said, what other experience, what other rotation are you going to have this kind of exposure, this kind of experience, this kind of, dare I say, intimacy with your patient? That is so important in what we do. To make a visit, to take care of issues, but at the same time to have a birthday cake and wear a birthday hat. How cool is that? And having that trust, having that relationship. You talked about prestige and not getting paid. That birthday cake, I think, was worth all the prestige and the pay for the rest of that week. I really, and I've said this before, house call medicine gives you an insight that no other medical specialty allows. It's pulling back the curtain and seeing the patients, what their stories are, what their struggles are. It is so enriching and terribly rich experience that you can share with audience like this.
Awesome. Excellent. Excellent. Thank you, Dr. Cheng, Julie. And we do have questions coming in now. And one of them actually dovetails into a question I was going to ask. Again, going back to the reporters, one of the things that we continually are working to get them to understand is that this isn't just doctors providing this type of care. It's NPs who are really the fastest growing segment. So nurse practitioners, physician assistants, and others. And the question we just got, are you extending the primary care at home experience to non-physician providers such as NPs or PAs? Dr. Cheng, I'll send that over to you first.
Yep, I can talk about it, I should say, from my own practice model, and then I will hand it off to Julie, who can describe on a national level in terms of where the providers are coming from. My own practice here in Northwestern Medicine, I'm a part-time clinician. Recently part-time, I'm doing more work with HCCI now, trying to spread the mission of this kind of care across the country and locally around Chicago. I'm supported by 4 amazing full-time nurse practitioners, each of them bringing their backgrounds and talents into the homes, into the team, I should say, caring for our patients at home. One has a particular ICU background, one has a neuro background, one has a wound background, and one has a home health background. So each of them bring a perspective, a level of expertise to the office and to my practice, to our practice, that we can all learn and share from one another to all strive to deliver the best care possible to our patients. So yes, I love my nurse practitioners. They're an amazing part of my team. Julie?
Yeah, like James said, we see nurse practitioners growing they're the fastest growing professional group that's doing this kind of care. And what we've heard from them is that it really kind of integrates nicely with the way they are trained, because they're trained to look at the whole person. And what better way to look at the whole person than to be in that person's environment. And then there was one other thing I was going to say about that. James, will you say the question again?
Yeah, it was about how are we extending the primary care at home experience to non-physician providers such as NPs or PAs?
Oh, I had another point about that.
While Julie thinks about her answer, HCCI, we are also networking, collaborating with the American Academy of Nurse Practitioners, or American Association of Nurse NNP, and we've been involved with some of their yearly meetings, doing some presentations there. Again, equipping them, number one, getting them interested in doing this kind of work, and number two, equipping them with the skill sets necessary to do this job well.
I'm going to think of the rest of my answer as soon as we hang up. But
Well,
go ahead.
The great thing about this is that there will be a recording available. So if there is an answer that you need to share, we'll share that in the follow-up communications. The other question we received was around, how do these, for people looking for these types of practices, et cetera, how do they advertise themselves? How do they promote themselves? And it really, I'll start off the answer and then I'll turn it over to Dr. Chang and Julie. And really, there's a myriad of ways, right? We tell all of these providers and practices, make sure you have a website, make sure you have an online presence. Because thinking about it yourself, if you needed it, where would you go, right? You'd probably go and try out, the Google machine, and so make sure that they want to make sure that they're able to be found. So a website, social presence, so pages on LinkedIn, Facebook, etc. They're putting out flyers in community areas, etc. But they're also working with other healthcare partners to get referrals, to get the word out. So with that, I'll just turn it over to Dr. Chang. How does your practice advertise?
So as I look at our referral patterns and our referral sources, I'll give you the top three, and from the top three, you can imagine where you are and how you may want to advertise to these top potential referral sources for you. James already said about the internet. That's absolutely, we all Google now, right? And that's very important to have a online presence. For me, the referral sources are not in any particular order. One will be home health. So you can advertise yourself to a home health agency, because we are in the same space with them, taking care of this often the same people. So having a handout about your practice, meet with home health agencies, I think that'll be that could potentially be one avenue to get additional referrals. The other will be discharge planners at the hospital or the emergency room. Your local hospital, I'm sure they all struggle with some of the same things, the type of patients that my local hospitals are struggling with. What are their pressure points? Is it the frequent flyers with multi-complexity that doesn't have a PCP, that's not following up with their PCP? Again, having a short blurb, the elevator speech, I think James talks about, ready to talk about what you can offer them, and having a handout for them to refer to in the future. So discharge planner. The third would be a medical group at the hospital, in terms of whether it's a hospitalist group or a local internal medicine group that may be carrying older patient population. Make yourself known to them, talk about your services, what you're able to do. Again, having that handout for them to either they can screenshot it onto their phone or put it in the lunchroom or something like that. So it will remind them that you are an option for them when they have challenging patients, that they are scratching their heads on what to do with these people, that you can be that additional discharge decision point for them to be cared for at home. So again, home health agencies, there's one more, home health agencies, discharge planners, a local hospital group or hospitalist. The final one will be assisted living facilities. Often these patients, they still have a lot of needs. Many of them are not driving. I'm looking at one now across the street. Many of them, the residents there are not driving, and they have to take a shuttle bus or whatnot to get to their clinicians. So make yourself available to assisted living facilities, may be another option to increase your not awareness, your visibility. Thank you. In your community. Julie?
I was just going to mention, I had said earlier about asking, but the more and more people that are over 65 that are joining Medicare Advantage programs, the Medicare Advantage program should know, they want to take care of their beneficiaries, and they want them to get the best care, preferably at the lowest cost. And that's what this does. And so, there's usually a very supportive relationship between those plans and the house call doctors. And so I think letting, seeing what your plan that you have a contract with can do to promote you. I would imagine that, different ones do different levels of support, but as a practice, I would ask that question.
Great. Well, it has been quite an hour almost, and wanted to thank everyone who has attended. I hope everyone learned something. I know I definitely did. And we're going to jump off here in just a second, but I wanted to ask Dr. Chang, if you could quickly, just because we only have a few minutes, if you could quickly read, you shared with me a letter earlier that you just got from a patient. And I know when you read it to me, I got goosebumps. So I'm guessing that the people watching may just get goosebumps too. Could you read that for us?
Yes, I will. Julie earlier talked about one of the challenges about prestige and money and so on. Of course, that's a question you all have to answer for yourselves. I cannot answer that for you. But this letter that I got this morning just reaffirmed to me why we exist as a practice and the critical need of this kind of service to our patients. And I'll just read this. Again, it's addressed to me, and please, it's not only to me, it's to my staff. I'm going to blank out some names here for obvious reasons. It says, Dear Dr. Chang and team, you have been caring for 3 generations of our family. 12 years ago, our grandmother, 5 years ago, our sister, and most recently, our mom. Words cannot express the appreciation we all have for you, all you do, and your caring ways. God has put special people on earth to do the type of work you do. You and your staff are the elite among them. The immediate responses for anything was incredible and almost instantaneous. We hope you know how special your staff is. We cannot express enough praise for them. We don't know how we would have come through this journey without them, not only once, but 3 times. I thank the good Lord for you and your work and pray all the blessings, all you deserve and sent your way daily. You have certainly provided much support in a very stressful time of the unknown. Thank you from the bottom of our hearts, sincerely. What else can I say? Take that to heart. Like I said, I'm going to put this away as we all encouragement, and we need reminders as to why we do the stuff that we do. Julia gave you lots of statistics on why and so on and so forth, and they are important. But letters like this, wow, powerful words, honest words, nothing from whatever, some commercial generated. These are heartfelt words from my patients. It encourages me, it reminds all of us here at my office why we do what we do and the critical need of this kind of care.
Well, thank you, Dr. Chang. Thank you, Julie. I also have no words that could top what you just read. So I'm just going to once again thank everyone for attending. And we do encourage you to do the things we talked about today. Stay connected with us. We're here to help. If you have a question we didn't answer today, just contact us. We're really nice, and we're pretty funny too a lot of the time. So that works out well. There's our website. There's our phone. There's our email. So please do stay in touch. And just remember that the future of house calls really is in the home. Thanks for joining us. Bye.